Welcome to today's Sustainability Day Roadshow. It's the first of a series taking us all the way up to March 24th next year. Last year we had around about 165 NHS trusts do something on the day. This year there's going to be a lot more emphasis being put on how we can talk to trusts and help them out and become a bit more of a support body, hence the reason why we've got the SDU. So with our partners that you see here today, we're going to be working more collaboratively to put them in contact with some of these trusts and work at how they can actually support them on a few pilot projects to actually see by the end of the campaign and go beyond what difference we can actually make to the trust by actually coming forward and offering a helping hand. The whole aim being that we're putting emphasis on the benefits that the environment has on healthcare, but also trying to support facilities managers, environmental managers, procurement, supply chain and beyond about how sustainability can be embedded in health services.
Global Action Plan is an environmental charity. We specialise in harnessing people power to solve sustainability challenges, helping people reduce their environmental impact for the reasons that they come to the problem with, rather than the things that we might care about most, such as saving carbon or saving money. Operation TLC is one of my favourite programmes that Global Action Plan's delivered over the last 20 years. The programme is all about reducing energy consumption in hospitals, but we do that by looking at how nurses, cleaners, porters, staff on the ground can create a more healing environment that helps patients rest, recover, be comfortable and sleep better while they're in hospital. Firstly, want to give patients the best experience they can while they're in hospital, and so doing things like having an hour of quiet time in an afternoon where the lights are dimmed, they get the temperature to be right for patients, they close doors, turn off unnecessary equipment to make noise levels as managed as possible. That's all about giving patients the best time that they can. The second motivator that nurses talk about is giving the best environment to work in. And so that's often where the temperature bit comes in. For the finance director, we're able to show that there are significant energy savings with Barts Health NHS Trust. That's over £400,000 a year that they now save through staff operating their facilities more efficiently. And we think across the whole of the NHS, given that over £700 million is spent on energy consumption, that around £35 million of energy savings are available from people operating the estate more efficiently.
The goals that the NHS has around switching off lights and things like that. We are the people who are moving around that operation, around that business, and we can see those things and we can react and do something with those. And that is very much at the heart of what Don't Walk By is about. I mean, Carillion, are recording up to like 1.5 million of those instances and those conversations and those improvements every single year. Earlier this year we introduced a Don't Walk By app. So anybody, be it a Carillion employee or a client employee or a member of the public, can have that on their phone and they can be recording and reporting things that they're seeing and getting stuff actually done. We care about our own people, we care about our clients, and we care about the people that our clients care about as well. And that flows down to everything that we do. Any of the ideas that have come out of a conference like this, it's going to be Carillion that is actually behind the scenes making it happen on a day-to-day basis. And so our targets are very much around, reflecting and facilitating what our clients' needs are.
I mean, that's the key to it. I mean, it's clear we weren't going to change anything much about the area unless we could understand better what people were interested in, what they might like to see happen, and what would get them active or mobilised in different activities, and different things appeal to different people. It's actually taken quite a long time to get back to the challenge to sort of litter and fly tipping and waste, but we think people have come back to it because they can see other things beginning to happen. That there's a widespread awareness of greening wind growth. People are not always totally clear about the specifics of that, but if they think of it in terms of the vertical veg growing, the work on revitalising the park, on encouraging new gardens, on neighbourliness, which is very important for responding to climate change in areas, because we know from a lot of research on the impacts of extreme heat and extreme cold or flooding. What really helps the neighbourhood get through it is the fact that people know each other or will look out for those who are the most vulnerable. So rebuilding that neighbourliness has been a key part of what we've been doing as well. One reason why we set ourselves up as a membership-based cooperative was to ensure that the community had continuing ownership of what went on and was a force to be reckoned with. So the more our membership grows, the more the louder our voice, in a sense, in terms of dealing with the council or with other organisations. So I'm optimistic about where things might go in the future.